Hi, welcome to another episode of Medicine Simplified. This is part 2 video of cranial nerves. If you are referred directly, please do watch part 1 video and link will be provided in description. In previous video, we discussed first to fourth cranial nerves. Now we will learn about remaining cranial nerves. Let's begin with fifth cranial nerve, that is trigeminal nerve. It is the largest cranial nerve and it is divided into three divisions. First division is ophthalmic division. It is purely sensory. Coming to the function, ophthalmic division is main sensory nerve of upper face. It originates in superior region of face from surface of eyeball, tear glands, superior nasal mucosa, frontal and ethmoid sinuses, and terminates in pons. It passes through superior orbital fissure. Coming to the second division of trigeminal nerve, that is maxillary division. It is also sensory nerve. Coming to the function, it is a main sensory nerve of lower face. It originates in middle region of face from nasal mucosa, maxillary sinuses, palate, upper teeth and gums, and terminates in pons. It passes through foramen rotundum and infraorbital foramen. Coming to the third and largest division of trigeminal nerve, that is mandibular nerve. It is a mixed nerve, consists of both sensory and motor fibers. Coming to the function, it supplies sensory fibers to lower region of face and supplies motor fibers to muscles of mastication. Sensory origin in inferior region of face from anterior two-third of tongue, tooth, gums, floor of the mouth and durameter, and terminates in pons. Motor nerve fibers originates in pons and terminates in anterior belly of digastric, masseter, temporalis, mylohyoid, lateral and medial pterygoids, and tensor tympani of middle ear. It passes through foramen ovale. We have made complete video related to mandibular nerve anatomy. If interested, please do check out that video. Link is in description. Coming to the sixth cranial nerve, that is Abducens nerve. It is predominantly motor nerve. Coming to the function, it helps in eye movements. It originates from inferior pons and terminates in lateral rectus muscles of eye. It passes through superior orbital fissure. Next is seventh cranial nerve, that is facial nerve. It is a mixed nerve which consists both sensory and motor nerve, but predominantly motor. Coming to the functions, it supplies motor nerve fibers to facial expression muscles and secretomotor nerve fibers to lacrimal glands and salivary glands. Supplies special sensory nerve fibers to tongue which carries taste sensation via chordae tympani nerve. Sensory fibers originates from taste buds on anterior two-third of tongue and terminates in thalamus. Motor fibers origins from pons, and motor fibers are divided into temporal, zygomatic, buccal, mandibular and cervical branches. It also supplies somatic motor fiber ends on digastric muscle, stapedius and muscles of facial expressions. Autonomic fibers terminate on submandibular and sublingual salivary glands. It passes through stylomastoid foramen. Next is eighth cranial nerve, that is vestibulocochlear nerve. It is a predominantly sensory nerve. It helps in hearing and equilibrium. Sensory fiber originates in inner ear and terminates as fibers for equilibrium at junction of pons and medulla, and also terminates as fibers for hearing end in medulla. Motor fiber originates in pons and terminates in outer hair cells of cochlea of inner ear. It passes through internal acoustic meatus. Next is cranial nerve 9, that is glossopharyngeal nerve. It is a mixed nerve which consists of both motor and sensory fibers. It helps in swallowing, salivation, gagging, regulation of blood pressure and respiration, carries sensations like touch, pressure, taste and pain from tongue and pharynx. Also carries touch, pain and temperature sensations from outer ear. Sensory fibers origins from pharynx, middle and outer ear, posterior 1/3 of tongue including taste buds, internal carotid artery, and terminates in medulla oblongata. Motor fibers originate in medulla oblongata and terminates in parotid salivary gland, glands of posterior tongue and stylopharyngeal muscle. It passes through jugular foramen. Next, cranial nerve 10, that is vagus nerve. It is a mixed nerve which consists of both sensory and motor fibers. Helps in taste, swallowing, speech and regulates pulmonary, cardiovascular and gastrointestinal systems. Also helps in sensation of hunger, fullness and intestinal discomfort. Sensory fiber originates in thoracic and abdominal viscera, root of tongue, epiglottis, pharynx, larynx, outer ear and dura mater, and terminates in medulla oblongata. Motor fibers origin in medulla oblongata and terminates in tongue, palate, pharynx, larynx, thoracic and abdominal viscera. It passes through jugular foramen. Next, cranial nerve 11, that is accessory nerve. It is predominantly motor nerve. Helps in swallowing and movements of head, neck and shoulder. It originates in medulla oblongata and segments C1 through C5 or C6 of spinal cord. Terminates in palate, pharynx, sternocleidomastoid and trapezius muscles. It also passes through jugular foramen. Next is cranial nerve 12, that is hypoglossal nerve. It is also predominantly motor nerve. It supplies motor fibers to muscles of tongue except palatoglossus, which is supplied by vagus nerve. It originates in medulla oblongata, terminates in intrinsic and extrinsic muscles of tongue, thyroid and genohyoid muscles. It passes through hypoglossal canal. If you like this video, please like, share and subscribe to our channel. Thank you.